Dr. Jimenez, can you talk a little bit about your clinic, the Hope for Cancer Institute, and how that got started?
Yes, Scott. My history is a long one. I was born in Colombia. I grew up in New Jersey, and I went to medical school in Mexico. And, you know, traditional medicine, and my dad had prostate cancer. And
Okay.
so at this time, they lived in Houston. He went to MD Anderson. They wanted to do the radiation, the Lupron injection, and so forth. And he did have one Lupron. He didn't do quite well with it. And then he called me. I said, Dad, you know, give me a couple minutes and I'll call you back kind of thing. And so we got him taken care of. And I've been at Hope for Cancer now for 11 years at our facility. But I've been in the integrative cancer field for 23 years now. And, you know, we know that everything has its time, whether someone is approaching this from chemotherapy or radiation or surgical perspective, but always, always we should focus on the integration of the two if the patient decides to do chemo. But basically it's a non-toxic Hope for Cancer clinic, and you know, maybe later we could talk about the 7 principles of cancer therapy at Hope for Cancer.
Let's talk about those right off the bat, I guess. Talk about the 7 principles that you talk about at your clinic.
Yes, the 7 principles, basically number 1 is non-toxic cancer therapies, okay, where we look to have cytostatic and cytolytic effects on tumors. Number 2, and not in any order of importance, just the 7, number 2 is nutrition, of course. We know that that's the foundation of health, right? So we consider nutrition as a therapy in itself, not like an elective, right? That someone would say, oh, I'll do it or not do it. This is a therapy in itself. And, you know, the father of medicine said we are what we eat. But I think nowadays we take it a little further. We are what we eat, but we also are what we assimilate, and then we are what we eliminate, right? Because the more toxic this world is, the harder it is to assimilate our nutrients. And one of the first steps at Hope for Cancer is to rebuild the intestinal flora, right? We know that 85% of our immune system is in the intestine, in the Peyer's patches, of course. So this is step number 1, okay, through nutrition. And of course, in line with that also is detoxification, right? And there's obviously many methods of detoxification, but I think that the disturbance foci in the teeth are one of the main culprits of chronic disease, not only cancer. So dental detoxification plays a big role in our detox program. And that includes metal fillings, cavitations, and root canals, and any hidden dental infections. So all of our patients see a biological dentist where at least we provide the patient with the information, and then they could do it with the dentist we have, or when they go back home, they find a biological dentist and continue the work there, okay? But it is our responsibility to provide that information to them. And, you know, before you and I were talking about education, I think that it is lacking in education in the general public with respect to dental, right? Because we think of, if someone has pancreatic cancer, well, you know, what's the teeth have to do with this, right? But it all really starts in the mouth. And, you know, Dr. Issos from many years back and many other German and other scientists who have really linked dental toxins to chronic disease. We have a short video from the University of Calgary where about 15 years ago they isolated in lab animals how mercury toxicity can affect the neural fibers in the brain cells. So now you've heard that more people have dementia, Alzheimer's, Parkinson's. The incidence of MS hasn't decreased, on the contrary, right? So removing these metals is a top priority. And of course, the correct removal of these metals, right? And at the appropriate time when the person is psychologically ready for it. And because besides it being a physical trauma, it's also an emotional trauma to wake up and maybe not have a tooth or several teeth for weeks or months till they can put partials in, right? So, so that would be the third key principle is detoxification, and that also entails colon cleansing, liver, gallbladder. We know that the liver is the biggest organ of detoxification other than the skin, so we have to really care for the liver. And in my opinion, every one of us, and cancer patients, chronic disease patients, should always address the liver, even if there's no elevation in liver enzymes, or the doctor tells you, oh, the liver is perfectly fine. Always work on the liver.